Hello, everybody. I'm just waiting for Niya to bring. Oh, hi!
Hi.
Can you see my face?
Yes, I can see your face. Can you see mine?
I'm so happy to have you here.
I'm so happy to be here with you. Thank you for inviting me.
Okay, well, now we have Niya. She's an expert, she's a yoga therapist. She's also promoting self care, self love. She also likes a lot of good work for the public for free because she's an activist also. She has an amazing background. She has been dealing with chronic pain and eating disorders. But I will let her to introduce her. I'm just so happy that she's here, and we're going to talk about what's the difference between yoga therapy and normal yoga, and what can benefit from us. So go
Awesome.
ahead. Who are you?
Thank thank you so much for having me and for sharing this space with me. Um, so I am a yoga therapist. I've been practicing yoga probably in truth, my whole life. The physical practice sort of happened in my teens, but I grew up in a family that very much sort of, thought of yoga philosophy. My grandfather actually used to teach yoga philosophy. Students would come to our house and would actually, I have this very clear image of being sort of 4 or 5 years old and he's sitting in the living room on a chair and everyone is sitting at his feet. So that was very much part of my life growing up. But as a kid, I also grew up with a lot of chronic pain. So joint pain, nerve pain, all of this stuff runs in women in my family, which is why sort of the work that you're doing to encourage women to move more and feel better is very resonant to me because the movement practice for me has been really useful in managing that pain. But as a kid, I remember there were days on end where I couldn't sleep because it hurt so much. My ankles hurt, my knees hurt, everything hurt. And so I didn't move very much as a child because sort of the notion of, getting out of bed, going to school and coming home was it. I couldn't handle very much more than that, except to swim. Swimming was helpful because, there's no impact on your joints. So that was probably one of my first movement practices. And of course, when you don't move, you gain weight. And then there's all those fun body image issues that come with that as a kid. And so I struggled with disordered eating for a very, very long time as a result of that. And then, of course, when I was 13, my family moved to Canada, and then there was all the anxiety about sort of living in a new place and not having any friends and all of those things. And so my dad actually sent me to my first yoga class, like formal, go to a class with a teacher when I was 13. And I don't know if he deliberately did this. He says it was an accident, but he signed me up for a class with seniors. So they're all like 80 years old. I was 13, so I walked into this room and I was like, this is terrible, but awesome because all these 80-year-olds were just like so in touch with their practice and their movement, and sort of the teacher would say something and they would do something different because they knew what felt right for them. And as a 13-year-old, I was like, I don't know what feels right, but if this 80-year-old can do it, I should at least try. So that was really fun to be in this like very safe, accepting space, trying these movements that I had sort of watched people do for a long time and having that philosophical understanding. And so that's where I started my practice doing gentle seniors yoga, um,
You
which
already
was
have
really,
experience.
yes. So I was like preparing for my life as a senior by doing these things as a 13-year-old. And from there, sort of I continued to practice. I went to university. I used my yoga practice to really help manage being very stressed out as a university student. And it was really helpful to manage my anxiety, but also I went from sort of, being in school and sort of moving, at least as you do, sort of as a high school student, to sort of being at my desk as a university student for really long periods of time. And sort of studying anatomy and studying biomechanics and studying physiology, but not really moving except when I was going to my yoga practice. So that was really nice to have. And then as I, got older, I was just like, oh, I should try all these other gym things. And so I got a gym membership, I got a trainer. I hated lifting weights. And because of sort of my existing joint pain conditions, it was also very easy for me to injure myself.
Mm.
And so, I'd work with my trainer and then I'd pinch a nerve in my shoulder or I'd like pull something in my knee. And so I realized I was only going to the gym to go to their yoga classes. So I figured I might as well just learn to do it for myself. And so probably in 2016, I did my first teacher training and that was amazing. because I learned all of the things that I needed to know to keep myself safe in my practice. I learned sort of where to push or what new things I could do to support all of my joint mobility, which then means I can move now pretty much pain-free every day, which I think back to sort of being a 4-year-old and not being able to sleep because I was in so much pain. And now I wake up and I'm like, yeah, I can do this. I can teach 3 classes and, work a full day and nothing hurts. So for me, that's been the biggest gift from therapy, is sort of returning to that safe, sustainable relationship with my movement practice and with my body. So I can now offer it to other people, which is a big thing for me. It makes me really, really happy.
That's great. But what's the difference between yoga therapy and normal yoga?
So normal yoga, at least the way I've experienced it, is, you go into a room, there's anywhere from 20 to 100 people, depending on the studio. You have one teacher who shows up and pretty much teaches you what they want to teach. And this is how I was actually originally trained to teach yoga was, you design your sequence ahead of time. You figure out, what your goal pose is and what you're going to teach people in order to get to that goal pose. But there's 20 people. I don't know sort of what their injury history is. I don't know if they've ever done yoga before. I don't know that they understand what I'm saying a lot of the time, because sometimes teachers will also use the Sanskrit names for poses, or they'll use different names for the same pose. So I've seen people call it, tabletop or triangle. And I was like, I'll do what I think is a triangle. And then I realized they mean something completely different. Yeah. So I was like, what does it even mean to be in a room with 20 people where there's only one teacher? So if I'm in a pose that might not be great for my joints, they can't really help me because, and it was the same when I was a teacher. I'd see 6 students and be like, this is misaligned. This person is going to hurt themselves. This person might fall. But I can't help all of them because I'm only one person in the room. So yoga therapy, conversely, is very personalized. So as a therapist, I work with a student one-on-one. It used to be in person, and hopefully now that people are getting vaccinated, I can go back to seeing people in person, but currently virtually. So we'll sit down, we'll do a full intake. So I'll learn everything you want to tell me about how your joints are feeling, where there's pain in your body, if you have an existing medical condition. If you've had surgery before, which also makes a big difference to your practice. If you're, a female-bodied person, if you've been pregnant before, which will also make a difference. If you're on medication, what your diet is like, what your sleep is like, what your energy is like. And then I take all of that information and design a practice for you that meets your goals. So it's not what I want us to do today on any given day, it's what you want to do. And so I have students who show up with chronic pain, like me, who have a hard time getting out of bed. And so our practice is very much breathing and then just really gently moving all of the joints so that the mobility remains, there's no adhesion, the fascia is still hydrated. But I also have students who are former dancers who want to go back to doing the splits. And so we work on hip mobility and we work on making sure their hamstrings are lengthened and, their low back is flexible so that they can go back to doing the splits in their 60s. So it's very much personalized, which is what I really love because there's a nice piece of problem solving there for me, which then, of course, my brain is engaged. I get to bring all these tools in. So that's the biggest difference, is that it's for you, it's for your goals, and it will fit where you want it to fit in your life. So if you only have, 5 minutes in the morning for practice, that's fine. You don't need a full hour. You don't often need any equipment except a floor and a wall. And, if your cat wants to join you, great. If your puppy wants to play with you, that's also fine. We can work all of those pieces in.
Okay, so my next question is, who can benefit of yoga therapy? It's only for people who they have chronic pain or some pain, of everybody?
It's really for everyone. I actually get this question a fair bit where people are like, oh, well, do I have to be flexible to practice? Do I need a chronic condition to practice? And so long as you can breathe, you can practice, but you will also benefit. Yoga therapy, while therapeutic, and so you can show up with sort of any sort of chronic condition, cancer, heart disease, diabetes, but you can also feel perfectly fine and want to keep feeling perfectly fine. So there's also a preventative and maintenance aspect. So I have students who, are competitive dancers and they're like, I want to keep dancing. I'm, 25 now. I want to be dancing it when I'm 60. How do we keep it there? So we can manage injury prevention. We can ensure sort of you have the energy to do everything that you need to do as your life changes and as your body changes. So yeah, you don't have to be dying, please. I mean, if you are, please come and see me anyway. But also, if everything is still feeling fine and you want to keep feeling fine and keep staying healthy well until, your 90s, or if you're going to be 100, then into your 100s, it can also be very useful for that.
Okay. As a yoga therapist, what has been the most challenging thing that you have to overcome? It's how to
Cool.
manage the chronic pain, or how to manage clients, or what are those challenges?
There have been a couple of challenges. The first one has actually been moving to a purely virtual environment. So as a yoga therapist, traditionally when I see a student, I would, take your pulse. I would, you know, do an assessment of the curvature in your spine. And a lot of this was sort of very touch based. And now I'm just like, how do I take someone's pulse on Zoom? I don't know how to do that. So that's been fun. Mercifully, there's, most people have smartwatches or other tools that we can use. So that was a bit of a learning curve for me at the very front end. But also, sort of, people don't have the luxury of space. They can't put a camera 6 feet away so I can see them when they're standing up and lying down and sitting. So figuring out sort of how to get the information to make good, helpful decisions has been a good learning for me because now I ask better questions of them. So it's not just like, how does it feel? But it's like, oh, what does it feel like in the top of your shoulder? Or how does it feel in some other part of your body? So I'm a better therapist for that. The other piece that I'm still sort of learning how to do well for my students is building a consistent movement practice. So as a therapist, I'll design it for you, we'll work through it, we'll make sure it feels right, but then it's for my students to actually do their practice every day. I'm not in a position, and I don't think they're in a position where I can show up every day and do the practice with them. So building those habits, sort of helping them change their lifestyle to make room for movement in a way that feels good and is sustainable for them is sort of an ongoing piece. And so whether it's scaffolding their practice onto an existing habit, like one of my students does her practice after she brushes her teeth every morning. So we designed the practice so she could do it in her bathroom. So that way, brush teeth, do practice immediately. Or, some people will do it after a dog walk if they have a dog. Some people will do it with their partners. So it's figuring out where to scaffold that habit so that it happens on a regular basis, which I think both for me as a therapist is a challenge, but also for my students is a challenge.
That's awesome. One other question I have is, what do you think is the future of yoga therapy? Because honestly, I didn't know what was it. I didn't know that even existed until I met you. So what does we need to get more awareness to yoga therapies? It's something that I can just study as a yoga therapist, or do you have a special background? You have to know about anatomy, to know about medicine, or it's how?
It's a great question. You're right. Most people, when I say yoga therapy, they're like, oh, so I sit in child's pose and we talk about trauma, which is not true. That's not what we do at all. Um, it is essentially using the tools from yoga, which are all evidence-based. I mean, they've been around for 5,000 years. There's lots of texts on them. There's a lot of great research on them. And so a lot of it is raising awareness. There are only 200 yoga therapists in Canada right now, so it's a pretty young profession. There's not a lot of us out there. And so I'm so grateful to sort of have this space to share this information with people so that they realize that we're there. And we work very closely with care teams. So when I'm seeing a student, I would, be talking to their doctor if they wanted me to have that conversation. I'd be talking to their psychotherapist, their chiropractor, their osteo, their dentist. Like I have students with TMJ, temporal joint mandibular disorder, which I also have. So, I'd be talking to their dentists about how we can ease their jaws. So really any other care providers that you work with, your yoga therapist will work in complement to. So we won't design something completely different that takes you in another direction. But we fit into an integrated care plan quite well, actually, because everything we do is complementary and non-invasive. And if you wanted to be a yoga therapist, there are, I think, 7 schools in Canada that are accredited to deliver the program. You do have to already have done some form of yoga training. So it's usually either a 200 or a 250-hour training that you can probably do at the same school if you're interested. And then from there, and that training covers sort of the basics of anatomy, the basic principles of yoga, usually a little bit of philosophy. And then from there, you would spend another 1,000 hours training, which is what I'm currently doing. So it's kind of like doing a master's degree, to be honest. Like there's a big in-class portion, and then we do 3 clinical level practicums. So one in a small group, one in a specific condition, and the one I'm currently finishing is sort of broad, see people with a bunch of things, help all of them figure it out with the supervision of a therapist who is already trained and accredited.
That's
So
great.
yeah.
Then that brings me another question. How can you work together with other healthcare providers to have a better holistic approach to a person. So which is better for you, to work with a physio or with a chiropractor, or it's in general with any healthcare?
It's with any healthcare profession. So it really depends on sort of what the student is dealing with. So for someone who shows up with diabetes, as an example, I would work with their naturopath or with their nephrologist or sort of whoever is providing their primary care. And if that's a GP who is then managing a bunch of specialists, then it would be their general practitioner. But if I was, for example, working with someone who had, chronically tight shoulders and they were only seeing a massage therapist, then I'll work with their massage therapist. You don't have to go get someone to come see your yoga therapist. And in the same way, if you don't want to see anyone else and you're just like, no, I just have this problem, I just want to use yoga to fix it, then you can just see me and that's fine too. Or see your yoga therapist if it's not me. There's a lot of us out there who are very wonderful. But most of us are trained sort of, if you come in with x-rays, I can look at them and make sense of them. I don't need your doctor to interpret them for me unless you want to give me their interpretation.
Mm. Oh, that's great. It's like
Yeah.
one more healthcare provider that can help us to achieve what we want and to be healthy.
Mm-hmm. Yeah, and
Awesome.
we're pretty holistic. I find in Western medicine, sort of, your kidney specialist is only going to think about your kidney. They're not going to think about it in relation to the rest of your digestion and your nervous system and your bones, as an example. But as a yoga therapist, when you're like, oh, I'm having kidney problems, yes, we will work with that area of the body, but we'll also make sure that your shoulders aren't hurting and that you have the energy to get out of bed every day and that your digestion is still good. So it's a very holistic practice compared to the often very useful specialization in Western medicine.
I love that, because sometimes you can have a pain in a specific area, but that doesn't
Mm-hmm.
mean that the pain begins in that area.
Mm-hmm.
That means that maybe you have something else, that maybe it's not your body, maybe it's just your mind, or maybe it's your nutrition, or maybe
Mm-hmm.
it's any other things that could happen. It's just not that area. It's what you say. It's, we have to see it like in a holistic way.
Yes, and yeah, we
I
are very
remember.
much sort of.
Oh, sorry.
No, go ahead, go ahead.
Oh, I don't know if people have questions, but I know that you have a question about knees, about knee pain.
Yes,
So I don't know if
yeah.
you want to talk about it.
Yeah, no, that actually segues really well into what you were saying, where, often one of my Instagram followers asked me to talk about knee pain in women specifically because it comes up very often, but it's very rarely that it's just someone's knees that are the problem, right? It might be, you might have been pregnant and the, excess weight and the hormonal changes in pregnancy might have changed sort of the ligament connections, and now you have knee pain after that, or you may have an existing knee injury. Or like me, you might have grown up with chronic nerve pain, and so your knees are bothering you. So there's a whole bunch of causes. But the way we would work with that as yoga therapists is to figure out what's going on right now in the present moment. So the history of your knee pain, while important, is not something I can change. And so it would be, we do a little bit of an assessment to see how your knees are moving, if there's any sort of popping or clicking or cracking in the joint, which I know mine do. And I feel like most people as they get older start to hear their knees a little bit more, especially if you, have a dance background or a movement background. And then once we've determined what a comfortable range of motion is, then we might, a big thing we do in yoga therapy is actually to apply oil to joints to keep them hydrated. And so it can be a really lovely sort of self-massage movement, either in the morning before you get on with your day, or in the evening before you go to bed, just to spend some time rubbing either sesame oil or almond oil or whatever oil you would like to use that's appropriate for your constitution into the joints. And then just really gentle movement to ensure that, the joint is moving, that it's hydrated, that it's supple. And so that might be lying on your back and bending and straightening your knees. It might be squats. It might be something else that's appropriate for wherever the pain level is and what the movement level is. And then from there, we might do a body scan visualization. So you might visualize sort of light moving in through your joints as a way of pain relief. You might just notice what's happening in your knees, because I find sometimes, especially with my students with chronic pain, they don't think about what's happening so they can move through the day because there's otherwise so much pain to contemplate.
Hmm.
So yeah, it might just be tuning in to see what's going on, maybe noticing a difference over time. So yeah, there's a bunch of things we do to help people sort of just be in better relationship with their bodies. And then over time, as people get comfortable, we might do some weight bearing exercises using body weight or using additional weights. I love telling my students to swim because I found it so personally useful, but it's also really nice if you're dealing with joint pain to be able to move the joint with the support of water. So that way there's less impact, but you're still getting the range of motion. Yes, yes, visualization, such a big, important practice that we use that I find a lot of other traditions use, but maybe not as much. So it's especially for people who are dealing with pain, but also I find for people with fertility issues or people who are pregnant, often we'll do visualizations around sort of healthy babies and sort of healthy pregnancies that just it helps manage the mental stress of being in that space. So whether you're dealing with pain and sort of the general thought is, oh, this joint is not working or this joint is not functional, that sort of negative aspect, we try to switch to sort of a more positive, lighter, freer, happier, supported aspect in the visualization that may happen during practice or after practice.
Now
So, yeah.
that we're talking about visualization, my last question will be, how can you tell women out there that right now they are having some kind of pain? How can you tell them this is a quick exercise of visualization that you can try and maybe you will feel a little bit better until they call you?
Yes. One of my favorite visualization exercises to do, and I do this with my students a lot at the end of their practices. So you can do this in the evening before bed, particularly. It's a nice way to check in. Is, when you're lying either in bed or on the floor or wherever you choose to be, is to visualize the full moon. The moonlight is very cooling. It's quite soothing. It's also a nice sort of relaxation. So visualize if you have the moon that is full, you can lie in the moonlight itself, but that only happens every so often. So you close your eyes, visualize the moon, and then as you inhale, I'm closing my eyes as I do this, you can sort of just direct your attention to the joints in your body. So I like to start with my feet. And so just, notice what's happening in those joints. And as you exhale, maybe you visualize sort of the moonlight moving into those joints, cooling them. Maybe you find some space where the moonlight is sort of moving in. And you can take a few breaths there, just like inhaling and noticing the sensation. Exhaling and just like feeling the moonlight move through those spaces. And then when you're ready, you might shift your focus. You might, draw your attention to the joints of the ankles. Again, inhale and notice what's happening. Exhale and feel the moonlight, just filling those spaces with that sort of cool, calming sensation. Maybe take another breath there. And then next, inhale, maybe you take the attention up into the knees. And as you exhale, just visualize that white, cool moonlight filling all of the spaces in those joints. As you inhale, drawing the tension there. And as you exhale, just filling those spaces, fill with that cool white light. And then maybe next inhale, you take the attention up through the hip joints and the pelvis. Just noticing what that feels like. And as you exhale, just filling that cool white moonlight into those spaces. Another breath there, inhaling to notice what's happening in the hips. And exhaling, feeling the moonlight fill those spaces as well. And so you can continue this practice up the spine, across the shoulders, through the collarbones, into the elbows, the wrists, the joints in the hands. And then you can take it up the back of the neck, into the jaw. I like to spend some time here, especially at the end of the day. And then up through the face and out of the crown of the head. So it's just very relaxing, and that sort of visual of sort of moonlight and resting, people find it very, very useful.
Thank you so much for that.
No worries. Happy to offer guided meditation anytime.
Haven't heard the moonlight idea.
Yeah, we use moonlight mostly for relaxation in the evening. Also, sort of, there tends to be, at least in Eastern medicine, sort of the association of moonlight and calmness and more sort of the feminine creative side of the brain. And then sort of for people I find who are very tired, having a hard time getting going, we talk about visualizing sunlight, particularly in the morning. So if you have those days, especially when it's cloudy, like today in Toronto, and you get out of bed and you're like, it's dark, I don't want to do anything. And in the wintertime, especially, in the summertime, it's a little bit easier because there's at least light outside. But in the winter, when you're up and you just can't find that little bit of spark to get out of bed, we actually do a sunlight visualization in the same way. So instead of sort of visualizing cooling moonlight at the end of the day, you'd visualize warming sunlight in all of your joints, joint by joint, to sort of find that. And you might choose to sort of, as I'm visualizing my wrists, I might do this. I'm visualizing joints in my hands, I might do this, just to bring that movement in. Before you get out of bed, you don't have to stand to do this. You can do this in bed, so long as, you know, you're not sharing a space with someone who will be disrupted. It's a little bit of a caution. But yeah, just notice, visualize sunlight, and it can be a little bit easier to get out of bed in the morning with that extra boost of energy.
I will try it. Yeah. Okay, well, we have 3 more minutes. Thank you so much. I'm so happy to have you here. I just want to invite people to follow you. They don't know, but I started to take your yoga therapy sessions, and so far I have been loving them. I feel so much energizing in the morning, so firsthand I can recommend her. So please follow her. And
Thank
I don't know if
you.
you want to say one last thing about movement, about visualization, or about yoga therapy in general to all the lovely women that they are out there.
Yeah, absolutely. Yoga therapy is a completely accessible practice. So it doesn't matter where you are in the world. It doesn't matter what your sort of previous movement practice is like. None of that really impacts. We can go wherever you want to go, and we will start from where you are. So whether you can get out of bed or not, whether you can breathe or not, whether you're flexible or not, those are not prerequisites. If you can, as long as you can breathe. If you can't breathe, you might not be on Instagram because there's probably a bigger problem. But if you can breathe, we can work together. It's a completely safe complementary practice, so it will work in conjunction with whatever else you're already doing. And for up until the end of September, our sessions with me are on a pay what you can basis, and I donate all of the funds to charity. So it's for an excellent, excellent cause. So if you're looking to try it in a safe, non-judgmental way, please, please reach out. I would love to work with you and love to offer you a movement practice that fits you where you are.
Awesome.
Thank you so much for having me.
Thank you so much, and thank you for watching us, and have a great week and great day.
Hey. Bye, everyone.